Hi, and welcome to Forensic Intervention Services. This video will give you an idea of what we do, the roles on offer, and how we can take your career in a new direction as a Forensic Intervention Services clinician. Let's start with a look at our vision, mission, and values. Together, these guide the way we deliver a range of specialist services that contribute to community safety. Our vision is to become a world leader in forensic intervention services, enabling meaningful behaviour change in offenders. Our mission is to reduce recidivism by delivering evidence-based offending behaviour programs founded in the risk, need, and responsivity principles. And our values are to serve the community, work together, act with integrity, respect other people, and make it happen. So what opportunities are available? Our clinicians are qualified in a variety of disciplines, including psychology, social work, mental health nursing, and occupational therapy. They work in a number of different clinical teams, covering assessment and treatment across various prison facilities and community locations, which means plenty of opportunity to specialise in areas such as assessment, sexual treatments, disability, and high-risk interventions. You can join us in either a clinician or senior clinician role, depending on your level of qualification or experience, and develop your career as a forensic intervention specialist. In a clinical role, you'll work in both prison facilities and out in the community, predominantly with people who have a history of sexual and/or violent offending. Day to day, our clinicians undertake comprehensive assessments, including risk assessments, facilitate or co-facilitate treatment programs, clinically interview individuals to decide on treatment pathways, and prepare treatment plans, treatment reports, and risk assessment reports for internal and external stakeholders. There is a need for some work-related travel, so you'll have access to a work vehicle. If you join us as a senior clinician, you'll lead a team of clinicians and contribute to the strategic management, development, and delivery of our psychotherapeutic services. In this role, your key responsibilities will be to mentor and supervise clinicians to support delivery of program interventions, manage staff performance and development, and carry out designated portfolio duties. Now that we've covered what the roles are, let's take a closer look at the kinds of treatment programs you'll be working with as part of Forensic Intervention Services. High Intensity VIP, HVIP. This is a high-intensity program which targets a range of criminogenic needs and risk factors related to violent offending. Moderate Intensity VIP, MVIP. A moderate intensity program which targets a range of criminogenic needs and risk factors related to violent offending, prison only. Changeabout, a program that targets a range of criminogenic factors specifically associated with intimate partner violence. See Change for Women, a program that addresses a range of risk factors relevant to violent offending in women. Better Lives program. This program is designed to address sexual offending behaviours created along best practice principles of CBT, DBT, and ACT. It's run based on intensity levels ranging from moderate low to high. We provide group or individual sessions, and on average, our clinicians tend to run 3 group sessions per week. These sessions have 8 to 10 participants and are always facilitated by a team of 2 clinicians. Here at Forensic Intervention Services, we truly value our clinicians, so you will benefit from comprehensive training, support, and professional development, including a dedicated clinical induction program for new clinical staff, including foundation, theory, and mentored on-the-job training, exposure to leading national and international experts in the area of forensic work, AHPRA registration or Professional Association membership funded annually, supervision by senior clinical staff, paid supervisor training for eligible senior clinicians, recognition of high-performing staff through the Commissioner's Clinical Scholarship Program and the Commissioner's Clinical Conference Grants, an annual leadership forum and conference, training and learning and development opportunities, and relocation allowances for eligible candidates. If what you've heard so far has you interested in joining our growing team, then here's what we look for in terms of qualifications. You'll need to have general registration as a psychologist with the Psychology Board of Australia, or be eligible for membership of the Australian Association of Social Workers, AASW, or be credentialed as a mental health nurse with the Australian College of Mental Health Nurses, or be registered as an occupational therapist with the Occupational Therapy Board of Australia. Senior clinicians will also need to have specialist training or postgraduate qualifications in a clinical or forensic field. Approved supervisor status is also desirable. If you've ticked all those boxes, applications for clinicians and senior clinicians are open all year round. Our recruitment process takes around 8 weeks, and if you are successful, you'll progress through a number of stages, including an online or in-person assessment centre, security, safety, and reference checks, and a formal offer. For more information and to apply, you can register here for one of our online Q&A sessions where you can chat to members of our clinical team. Good luck. We look forward to hearing from you.